When COVID-19 emerged in late 2019, EU countries struggled to control the spread of the SARS-CoV-2 virus. The scale of the pandemic and the differing levels of emergency preparedness and response in each country made cross-border collaboration challenging. The pandemic highlighted some vulnerabilities in this response and underlined the need for an EU-wide approach to the next pandemic, including how we collect, analyse and share our data to make public health decisions.
It's an area I've been working in for over 25 years, the area of emerging infectious diseases. And when I was based in WHO in Geneva, we never predicted anything as devastating as COVID-19 in terms of the disruption to society and the devastation to economies. We know that from working in this area that there are other threats out there. We need to make sure that we improve our ability to respond to the next pandemic.
PANDEM-2 builds on PANDEM Phase 1, a project that identified international best practices in various domains relating to pandemic risk and emergency management, including surveillance, communications and governance. The recommendations from this project form the basis of PANDEM-2, applying expertise in public health, epidemiology, information technology, communications and visual analytics to create a digital platform that will facilitate effective and standardised preparedness and training functions for future pandemics. Advances in surveillance, situational awareness, communications and training that have been made during the COVID-19 pandemic are being incorporated into project outputs. The first output that's been established is PANDEM Source, which collects pandemic-related data. It is one of the first tools of its kind to allow users link NGS or next-generation sequencing data on variants of concern with other contextual metadata that will help give wider context to a pandemic. The data collected is being integrated into the project's dashboard. This captures, standardises and analyses data from a variety of sources around the world. These include epidemiological, laboratory, NGS data, contact tracing databases, social networks, mass media, and web-based participatory surveillance initiatives like InfluenzaNet that collect citizens' voluntary reports of their symptoms. By collating these sources into one place, the PANDEM-2 dashboard will have the ability to analyse comparable epidemiological data in real time, as well as patient pathway and resource models. This will provide users with actual data on how to resource a pandemic. This powerful tool will enable first responders, policymakers, and public health leaders to make more informed, data-driven decisions in a health crisis. PANDEM Source has been designed with ease of use and interoperability at its core. The program is easy to install and open source, making it flexible to the requirements of any government or response team. Users can adapt sources, variables, and indicators within the software, or manually integrate their own data using PANDEM Source template files. The dashboard will also facilitate pandemic preparedness training across Europe, allowing public health teams to test and refine their response to future health crises. Using predefined parameters, the dashboard will have the power to run epidemic scenarios that will allow its users to assess their preparedness for a future health emergency. Pandemic managers will be able to access maps of where the disease is transmitting, analyse case notification, mortality data, assess availability of stockpiles of PPE, vaccines or ventilators, and areas where there is possibility for a sharing of resources across borders. PANDEM-2 also provides valuable tools for communicating during a pandemic, including media training resources and guidance templates for social media communications, press releases and websites. All of these features have been created with the help of our end-user team, comprised of European public health agencies and first responders who are contributing their first-hand knowledge in public health to shape the PANDEM Source dashboard's functionality.
What I hope to have achieved is a set of IT tools that really make a difference to the management of a pandemic, where public health experts, first responders, frontline workers can access this data and make decisions in terms of controlling the pandemic. The ultimate aim is that the tools we develop will be used across all European countries, and it will allow a common platform to allow countries to exchange information, to learn from each other as to what has worked well. And what we hope is, while we've made amazing progress in this pandemic, we can improve it even further and be better prepared for the next one.